Welcome everyone. Thank you for taking some time to come out of the heat and join us in this nice air-conditioned room. And tonight we're going to be talking about chronic fatigue and fibromyalgia and a whole bunch of things that go along with that. My name is Will Rickett. I'm the business director with Renewed Vitality. And some of you probably know, how many of you are patients? Okay, so we have about half the group. Okay, well, welcome to everyone. So the things that we work on here, we do have chronic fatigue and fibromyalgia down here, and oftentimes that includes diagnosing and treating the thyroid. And it can also mean treating the male and female hormones. Oftentimes when people have chronic fatigue or fibromyalgia, there is weight gain. And so that is one of the things that we treat once people get back on track with feeling better. And then age management includes just everything to do with the aging process. And most of our patients want to either retain or regain their youthful energy and youthful aspects of their health. Sleep therapy seems to go along with everything as well, just because that is one of the classic symptoms that people have when they're not feeling well, whether it's a thyroid issue, whether it's a hormone issue, or whether it's chronic fatigue or fibromyalgia. And then body detoxification also is oftentimes part of treating chronic fatigue and fibromyalgia, and as well as treating chronic viral syndromes. We actually have 5 providers and 2 offices. Dr. Spurlock, who is here with us, who will speak in just a moment, is our medical director. And we also have in our Las Colinas office, Dr. Leanne Scott, and then 3 nurse practitioners, Elise Lewis, who's in the Las Colinas office, and Roxana Kokos and Amanda Holscher, who will be presenting here tonight, and we're delighted to have all of them. And I have to put this up for the attorneys and for everybody, just to let you know that I'll start off by saying you can believe what our providers are going to tell you tonight, but at the same time, you can't take the knowledge that you get tonight and go home and think that you can diagnose yourself and treat yourself for chronic fatigue or fibromyalgia or any of the things that we will discuss. So, and most importantly, the best thing to do is, if what we're going to tell you and you relate to some of the things that you hear tonight, the best thing to do is to speak to one of our providers. We'll be here after the seminar and ask questions to them and see if this is right for you. If you're not a patient yet, if you are a patient, then see if there might be something that additionally that we might do to make you feel even better. Okay. So here I am a few years ago with my beautiful wife, Roseanne, and at a certain point, it wasn't just at one time, it was over a series of years, I seemed to slow down. And I gained weight, I had a little bit of depression, I had headaches, I had brain fog, I got sick more often, and my wife turned to me and she said, "You've gotten old." She says, "You know, you're slow, you're fat, you're tired. What happened to the man that I married? I want that man back." And I said to myself, well, it didn't happen all at once, but I want that man back too. And so I searched and searched, and I went through quite a few doctors, and I did find a doctor, Dr. Spurlock, that helped me get back on track. And I'm very grateful to him for that. So what I'm going to do is I'm going to end my story right here and then let you listen to all of our providers about the different aspects of chronic fatigue and fibromyalgia, and then finish my story at the end. So with that, I'll turn it over to Dr. Spurlock.
Okay. Well, let's get some definitions out of the way first. When we deal with these disorders, it does not follow the traditional allopathic mode of medicine. That's why most doctors cannot help or treat these people, because they do not have a clue of how to help them. In that concept, actually chronic fatigue and fibromyalgia are the same thing. Well, that sounds weird, but they're the same thing. You can have chronic fatigue, you can have fibromyalgia, and most people have both. It's a matter of degree. We see a lot, not very many people with just fibromyalgia, but occasionally I do. We see a lot more chronic fatigue, and then chronic fatigue fibromyalgia is what we usually see. Now, why is the definition weird? Because allopathic medicine tells you symptom, diagnosis, pill. High blood pressure, hypertension, and a hypertensive. Diabetes, you get the antidiabetic medicine. That's how regular doctors treat patients. But that does not work for what we do, because our patients have a multiple amount of underlying conditions that each by themselves is not enough to really make you sick. I'll give you examples of that later. But when you combine all of them together, they're non-functional. So you have to look for all of these disorders in order for you to be able to identify it and treat it. So if I took every one of you in here today and we identified your 25 100-pound problems, as I call them, they would all be different. Now, there would be some commonalities. Thyroid is a fairly common problem for most of our patients. But then after that, it goes all over the place. So the trick is to treat all of those diseases simultaneously that are underneath. And then the fibromyalgia and the chronic fatigue syndrome go away, because they're not real diseases. They are syndromes of underlying diseases. If you understand that, then you can understand how we treat you. So when we're looking for things, we're not looking for one thing. There's a lot of, I hate to say the word crap, but that's what it is, out there that they have these new products that are really going to fix your fibromyalgia. Well, I think the company Saragen has a new product, and it's for people that have high tumor necrosis factor and substance P things. Well, I used to check those all the time, and it's like 1 in 1,000 of my patients had those. So I just stopped checking, because it was hardly worth fooling with. And all these people, they have this new fibromyalgia test, this test. Well, it's identifying one issue. So, and I don't know if you had been treated for fibromyalgia before, but if you take Lyrica or Savella or Cymbalta, it'll work for a little while, and then it just quits working. So we were all excited when those drugs came out for fibromyalgia, but they turned out to be almost useless. And some of those drugs are very difficult to get off of once you get on them. So the issues are, is we don't focus on one issue. If you did, we would never solve the problem. Now, what's the short definition of insanity? And expecting a different outcome. If we did what everybody else did, we'd have the same outcome. So in order for us to get a better outcome, we have to do something different. It's not, to us, it's not weird. But to a lot of other doctors, we seem weird. But they don't understand this paradigm. So it's very important that you understand this underlying problems we must address. And when they accumulate, they develop all these symptoms. The other issue with them is they're progressive. A patient came in today, and she says, Dr. Blake, we're finished with my exam, but I need to ask you about my niece. And her niece is 21, and she's really very neurologically messed up, very badly. And she's not functional. She's not able to go to school and those things. And they've taken her to a bunch of neurologists, and they say, well, there's nothing wrong with you. She says, and I said, well, let me tell you the story of Hannah. And I told the story of my little 11-year-old patient I saw with Hannah that came to me in a rolling walker. And she had to wear sunglasses. She couldn't handle the lights. And I had to help her up on the exam table. She couldn't get up there by herself. And they'd been to Mayo Clinic, worked her up, told her she had massive deconditioning. Really. And they were going to make her do 3 weeks of physical therapy, 8 hours a day. Well, she might have lasted 20 minutes, and then she'd be in the bed for 2 weeks. So the issue was they didn't do that. They came back down here. They live in Longview. A Longview ophthalmologist says, you got to go see Dr. Spurlock. So they came to me. I told them also, your neurologist has missed the diagnosis. Go for another second opinion. But I found that she had Epstein-Barr virus in her lab work. And I said, what did they say about this? And they said, nothing, Dr. Spurlock. I says, well, I'm going to go ahead and treat her for this while you're going to see the other neurologist. So I did. Well, they pussyfoot around and go to the other neurologist. In 1 month, she was 50% better. And she's now 18 and she's going to high school. She's about to graduate, plays golf every day, does everything she wants to do. I told this lady, your niece needs to be seen by somebody that knows what to look for these underlying conditions, because the neurologists have missed it all. She's definitely neurologically challenged. But I don't know if you know, but I said progressive. If that girl is not addressed quickly, this will move into MS. People don't realize that these things are progressive, and they get progressively worse if you do not deal with them. Some of the people that come here are really vegetative, and I try my best to get them back, and most of the time we're successful, but don't come too late is what I'm saying, okay? Modern day energy crisis. There are many reasons why your energy is low, but it's this combination of things. Okay, so I'm gonna tell you a simple thing, just one simple thing so you can understand how deep this is. Iron. You ladies all know that sometimes y'all get anemic, you need to take some iron. We men, that's really a problem with us. But you ladies, that's a problem. Well, iron is a paycheck. What does that mean? Well, you have a job. You make $200 a week and you have $195 worth of bills a week. And you're $5 flush every week. And your boss cuts your hours 20%. You're making $160 a week now, but you still have $195 worth of bills a week. You don't have enough to cover everything. So what does iron do for you? Well, we know it makes red blood cells, and that's very important. It carries oxygen. That keeps us alive. That's critically important. It also makes dopamine in your brain, and so you're happy. It makes your hair grow. It makes the energy molecule in the Krebs cycle. It makes the energy molecule. It's a very important cofactor. And it keeps your legs still at night so you can get a good night's sleep and you don't have restless leg syndrome. So you're making $160 a week, you have $195 worth of bills. You pay for the rent, you pay for the utilities, you pay for the food, but you let the credit card slide because you can't cover everything. The body does exactly the same thing. It'll pay for those red blood cells, but you don't have to be happy, you don't have to have hair, you don't have to have energy, and you don't have to keep your legs still at night. But you got to have red blood cells. I want you to think about that for a minute. The energy crisis, that's just simply iron alone. Epstein-Barr virus attacks mitochondria, they'll talk about that later, and that's where your energy molecules are made. So the most devastating symptom of Epstein-Barr virus or infectious mononucleosis is fatigue. Okay, and then low thyroid. So you have no energy. You know, all these things are happening. But then there's so many other things. You ladies, and guys too, but they're different. My mother, if she doesn't have estrogen, she has that amount of energy. You put her on estrogen, she's fine. Men, they become big old couch pit of slugs without testosterone. You put them testosterone, they get outside and they start doing all the work again. So the issue is you have to have your repair molecules is what I call them. And you have to have plenty, not just fumes, plenty. All you need plus a little extra so that you have enough to get through everything. Now also, another patient of mine is called Sam. And Sam was a 6-year-old who got 2 bad infections about 6 months apart, and he collapsed after the second set. And we worked real hard. It took me 14 months. This is not always easy to get him back. We did, but he was so damaged, I had to rebuild the infrastructure in his body. And when we finally got all that rebuilt, he was fine. Now, how do we explain that? We supposedly won the war in Iraq, right? After we won the war, the infrastructure was so devastated that the towns were only getting electricity 2 to 4 hours a day. It took us several years to rebuild the infrastructure in Iraq so every town got constant electricity. That was not talked about a lot in the news, but that was part of it. Well, that's the exact same thing I'm doing to your body, is that we have to repair that broken infrastructure. And it varies from patient to patient of how much that is. You men are a little bit more protected because the testosterone is very protective of you. But the problem with that is you come in too late, women come in early, and we get it dealt with, and men come in too late, and they're harder to fix. So the issue is listen to your body. So nutritional deficiencies. Now y'all all know about B12, and if some of y'all take B12 shots, it makes you feel better. Well, that's because you're missing B12, that's why you feel better. But we all know that we have issues like that. Sleep. Well, that's your repair time. Every night when you go to bed to sleep, 2 things are happening. Your brain is actually working very hard, but you're unconscious. The brain is, do you remember the old computers that we had to defrag and we had to remove the cookies, remove the temporary internet files? So we don't have to do that anymore. But we used to. What happened if you didn't do that? It would slow way down and probably the blue screen of death. And that would be the end of that. That's exactly what your body does if you don't sleep. It's not doing its work, and it doesn't. The gut does the same thing. It's supposed to repair the immune system that's in your intestinal tract when you're sleeping. That's why you shouldn't eat at bedtime, because it's repairing, okay? So what if y'all have biofilms and you have poor biodiversity and you have irritable bowel syndrome and Crohn's disease? What do you think that gut's doing? Well, those all have to be identified and addressed. But sleep is very important. Overwhelmed immune system. A lot of you can have underlying infections you do not even know that you have. But it doesn't make you sick enough to go to the doctor. I had a lady that I was treating for mycoplasma pneumoniae, and I treated her 3 times. It came back 3 times. Okay, I'm tired of this. I says, who's coughing in your house? My husband. He's been coughing for 10 years. So I said, send him in here. So he came in. We treated him both at the same time, and it went away. He came to me 6 months later. Doc, I used to be able to sing. I haven't sung in 10 years. I can sing again. It was bothering him, but not enough to go to the doctor. Do you see what I'm saying? He was working full time. Little interesting tidbits about this. Introductions of antibiotics and acid blockers. Well, antibiotics came online, actually, that y'all don't know about this, in about 1985. The agricultural industry was allowed to put antibiotics in animal feed. Okay? Well, that's when all the ulcers disappeared. Well, what did we find out causes ulcers? H. pylori, Helicobacter pylori, a bacteria. Well, how do you get rid of bacteria? Antibiotics. So all of a sudden, we quit seeing ulcers and we started seeing reflux. But nobody asked those questions. It's because we were being fed antibiotics every day. If you're allergic to Cipro and they put it in the beef, and you get sick when you eat something, is it the beef or is it the Cipro? They don't talk about it. But then you're killing all your good bacteria. So, yeah, that was allowed. And the acid blockers, well, then you stop making the acids to digest your food. Well, what's going to happen next? You have undigested food going through your system. Is that really helpful? Now, I was talking to Laura before we got into this, but the issue is that this fat belly that we all get, it's a mechanical obstructor of the ability of your stomach to expand. So if it can't expand, the fluids just go back up the tube, up the esophagus. So we really need to fix our obesity epidemic. And I'm working on that right now. I was telling Laura about my new plans. But behind this is that these are things that have created problems. So if you're not digesting your food, you're not absorbing it, you're not getting nutrients, no energy. Hormonal deficiencies, a lot of the hormones, like I said, have to do with your energy processes in your body. That's very common, especially thyroid. Decreased exercise and sunshine. And again, you know, that's the thing. And there's a lot of issues, but one of the things is one of the best ways of detoxing is sweating. And when I was a little kid, we didn't have air conditioners. I live in the deep south. We had an attic fan. Everybody sweated. Nobody thought anything about it. We don't sweat anymore. We live in air-conditioned buildings. We have desk jobs. We're inside all day long. And we don't do one of our major detoxification processes. So it creates problems for us. So that's another part that goes with that. And then increased life stressors. And the issue with that, anytime you have something going on with you, you're burning up more of your nutrients. And so you're depleting yourself. So when we tell you to be calm and chill, it's really a real thing we're really talking about. Try not to let stuff upset you and try not to be around people that upset you. So they're, let's say, 2 different presentations of the same problem. They're both energy things. Now, question with fibromyalgia. This is a simple analogy. Writer's cramp. What happens when you get writer's cramp? The fingers tighten up. Okay? What if you straightened out one real fast? What would it feel like? It would hurt. Fibromyalgia, when you don't get enough energy molecules to your muscle, it shortens. And if you move against it, it hurts. That's simply what that is. Lack of energy molecules making it to the muscles, they cramp down, and when you move against it, it stretches it, it can even tear it. And I've had some people, it's so bad that there's layers of scar tissue that I'm having to work with them. So that is the issue. It's not getting enough to the muscles. So we work on a lot of ways to try to get your muscles to get enough energy molecules. And of course, you know, severe fatigue, insomnia, brain fog. Well, you know, if you're not functioning well, remember how it feels when you don't sleep? That's a good example of brain fog, you know, is that you're there and you're sort of floating, but you can't do it. I had a lady that came to me, she's about 55, you know, perimenopausal, and she was so messed up. I mean, she didn't really complain of chronic fibromyalgia, but she's so messed up. She didn't remember anything I told her. I had to tell her stuff 4 times. She still didn't remember it. So I just got frustrated, and I said, listen, I'm just going to write everything down on my note, and you're going to take it home and do it exactly like it says on the piece of paper. Because, I mean, she couldn't remember anything I said. She came back a month later. I'd already started her on estrogen, progesterone, and thyroid, and she was actually normal. And she could carry on a normal conversation. And I says, ma'am, I was really scared last time. I don't even know how you drove here. I says, but I'm really glad you're better. She says, Dr. Burke, you weren't as scared as I was. And I understood that real easily. But the brain fog can be really bad sometimes. But it's not, you're not getting older. That's not what the issue is. Now, I'll explain just quickly. Alzheimer's is just the loss of repair molecules. If you allow yourself to deteriorate because you don't keep your repair molecules, your brain deteriorates. If you maintain the repair molecules, you don't deteriorate. I'll give you personal stories about that later. And so it says no overt causes. There's nothing obviously wrong with you. They do the blood work. Well, you look fine to me. They frequently, with the ladies, I don't think they do it with the guys as much, but the ladies, they'll hand you an antidepressant here. This should fix your problem. Now, unfortunately, it may help a little, but that's not the solution, okay? But the issue is, the patient begins to believe that there must be something wrong with me personally. There's nothing wrong with me because the doctors all say I'm good. Well, that's not true. There is something wrong with you. Has it lasted over 3 months? And so therefore, you need to go ahead and have that checked. And you have widespread pain. Now, pain in fibromyalgia is muscular. If it's joint pain, that's not fibromyalgia. Okay? And not all pain is fibromyalgia. Some of my patients do have neurological disorders that we have to identify and treat, but most of it has to do, I know you've done this, and I'm on it. There's an amino acid protocol, and one of the things I've noticed is that it helps clear the plaque out of your arteries. And I've seen a couple of doctors that I treat that the nerve to their heart was acting up, causing a heart problem. And whenever I did the amino acid protocol, it started nourishing that nerve, and it got oxygen and nutrients, and they quit having the problem. So it's getting nutrients to the tissues. And so pain comes from many things. Okay, so overwhelming fatigue, severe insomnia, brain fog, achiness and pain, increased thirst. There's a couple of issues with that. Frequent infections or recurrent infections, allergies and sensitivities. On this frequent infections, there's a subset of patients that I have that we check them for their IgG levels, immunoglobulin G levels, and their other immunoglobulins. And they're extremely low. And I ship them off to my immunologist who do IV IgG treatments. And that's how we fix a lot of their problems. So we're not just locked in that we do everything for you. We find appropriate specialists to help you if we define things. But with these infections, see that some patients can't, they don't quite qualify for that. The insurance won't pay for that. It's expensive treatment. But they're sort of right there on the edge, but the insurance won't cover it. So we give them gamma globulin shots here once a month, and they're great. So that helps them. But again, individually, people have different problems. So allergies and sensitivities. And allergies, that's a strange word, and some of you may know about some of this. You can have reactivities to things. Foods, chemicals, mold. There's all kinds of things you can have issues with that can really knock you in the dirt. So you have to be careful with a lot of stuff. Anxiety and depression. And this comes for you ladies. For we guys, we don't have as good a solution as the girls do. Anxiety can come from just low progesterone. Depression can come from low thyroid, low vitamin D3, low estrogen, low testosterone. So those things may not be real disorders. They may be just low hormones. And then we've got weight gain. Well, if your thyroid is low, you don't have the metabolism to lose weight. And so you can do every diet under the sun, you may still not lose weight. And then decreased libido, well, of course, the hormones are all off. You don't feel good. Your brain's not working right. Well, yeah, you're going to have a decreased libido. The hypothalamus is right in the center of your head. And the pituitary gland hangs off of it as a thermostat. The hypothalamus is very, very important. We rarely see anything like a cancer of the hypothalamus, but we do know that that can get knocked off track. Now, for some of you ladies, you may know this, or maybe you've known people that have had it. A young woman will just stop having periods. And she's not cycling, and so it's sort of scary. And when I used to do family practice, they'd come to me and they'd say, Dr. Bullock, I'm having periods. And so we'd cycle them on birth control pills for 3 or 4 months, and they go back to normal, okay? So what we're doing is retraining the hypothalamus to do the traditional thing. Well, I have a lot of things, and Lark has really helped me with a lot of that over the years, of resetting the hypothalamus. And there's several things we can do that, and a lot of people, they're just not making hardly anything, and then we reset that, and they do a lot better. I have some patients that actually have completely absent pituitary glands. I have to replace all their hormones because they don't make them anymore. So, so this all has to do with sleep, hormones, because they put out the stimulating hormones for that, temperature regulation, and the autonomic nervous system regulation. Now, I'm working on some new projects now, and I'll show you one thing. I never will quit working on new projects because we're still barbaric in our medicine we practice today. We have a long ways to go. But I'm looking at this area right now. Oh, it went too fast. I'm looking at this area right now because I'm beginning to believe that ADD is not what we think it is. I believe that it's the adrenal glands are pumping out adrenaline, and that child is wired in a PTSD fight or flight syndrome, and that's why they're hyperactive. And you do a very simple treatment to stop that adrenaline release, and they're just cool as a cucumber. It's not their brains, but their brain is reacting to the adrenaline. So we do a spot urine for catecholamines to see if that child is hyperactive because they actually have something coming out of their adrenal glands. But you can have it as an adult too. It doesn't have to just be a kid. How do I know? Now, some people, like I talked about Sam a while ago. Sam, you know, he had it after 2 infections. He got knocked in the dirt. A lot of my people come to see me for that. The young people. The younger the patient, the more likely infections is going to be their problem. Injury, you know, and head injury. Y'all, a lot of you don't know that, but you get a head injury, you can upset that hypothalamus, and I may have to reset it. But a lot of the football players, horseback riders who fall off their horses, the people who play different sports, they have head injuries, and that can cause that. Pregnancy. Pregnancy in women, it's not the pregnancy itself that does it, it's the delivery process, and you can either go high thyroid or low thyroid, either way, after each pregnancy. So we have to monitor women very carefully. Postpartum depression is probably a thyroid disorder, okay? Toxic exposures, well, we talked about that a little bit. Heavy metals, the most common cause of lead poisoning in men in America today is going to the rifle range once a week. The air is full of lead. For you ladies, it's red lipstick. L'Oreal's the worst. So you have to look for lead exposure. I'm not going into depth. I could. And then yeast can sort of take over your intestinal tract, and it creates a bunch of problems. The hormone deficiencies, the chronic stress, autoimmune disorders, anything to disrupt sleep. Now, there's one thing sort of left out is genetics. Looking at your family and figuring out what they gave you at the table. Lack of deep sleep to heal the muscle. But remember, it's all about energy molecules, not getting to the muscles. So you obviously are not repairing during the night, and that happens. Not enough energy molecules, chronic pain amplified by the brain. There's also a belief in specific fibromyalgia patients that they have less nerves than the rest of us. And the body recognizes that and upregulates the sensitivity, but sometimes that goes too high. So they're in pain all the time, although there's no pain. But they actually experience pain. That's what low-dose naltrexone is for. It dampens down that sensitivity in the mu receptors, and they have less pain. So we use quite a bit of that to help with that. Inflammation of the tissue, especially infections. I had a guy to come in today, and he's very natural. He didn't want any real medicines. And I was working with him, and he had migraines, but I actually thought it was threefold. I thought that he had allergies that were underlying that were untreated. He actually probably had a low-grade mycoplasma infection over here on the left side, which was inflaming that whole area, which backs up to the brain, and that triggered the migraine. So I gave him a natural antihistamine type product. I gave him a regular antibiotic to get rid of this and get past that. And then I gave him a medicine just to help him with his headaches until we got past this. But the issue wasn't addressing the migraine. I was addressing the cause of the migraine. And then decreased nerve fibers with upregulation, and we talked about that with the naltrexone. So the summary here is inability to sleep despite being exhausted. One of the things we also see in some of our patients here is that they're reverse circadian rhythm. They're sleepy all day and they wake up at night. And again, that needs to be reset so that they can function again. And the brain fog, fibromyalgia with the pain, that also prevents you sleeping. If you're in pain all the time, you can't sleep. And so I had to have my gallbladder removed a year and a half ago, and my symptom was that I was having trouble sleeping for 3 nights because I felt this pressure in my abdomen. and it wouldn't let me go to sleep. It wasn't even real pain. It was just pressure. And so eventually I had to have my gallbladder removed. They occur when you spend more energy than you can make. So when you try to force yourself to do stuff, if you're true chronic fibromyalgia, you can do the activity, but you'll pay for it for the next 2 to 7 days. That's the sign that you have this. They've done some studies where they said, oh, there wasn't any real issues for chronic fatigue and fibromyalgia patients, that they really needed just cognitive behavioral therapy and some graded exercises. But what they did was they only studied them on the day they did the test. They didn't study them for the next 5 days and see how they responded, because the lack of energy, you'll use up what little you have. And that's why I warn my patients, I warn them real carefully. You might start feeling better with what I'm going to give you. Do not act on it. They go, well, what do you mean, Dr. Spark? Well, you don't know that yet, but I'm a husband, listen to what I'm telling your wife. Listen to her and stop her. Because she'll feel so good. Well, she hadn't really cleaned that house in 2 years. She's going to try to clean 6 rooms at one time because she has enough energy to do that. No, 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 no. Because you'll burn up those few energy molecules I got for you, and you'll crash again. Don't do that. Let yourself slowly rebuild the infrastructure. And then it's, a lot of people respond. And the SHINE protocol is Dr. Jacob Teitelbaum's treatment, which is sleep, hormones, infections, nutrition. And in the very end, you add exercise. Not in the beginning. It's SHIN to begin with, and then SHINE later. Discovering your unique problems and creating your individual treatment protocol. I talked about that early on in the lecture. Is that you have to determine what each individual patient's problems are. And we treat them all differently according to what we find. We don't treat stuff that's not there. We don't treat everybody the same. There's some doctors in town here that do that. Everybody gets hyperbaric oxygen. Everybody gets chelation. Everybody gets glutathione. We don't really do that. We really like to look at what's actually wrong with you. Optimizing energy production, eliminating energy loss. So again, it's really looking at, it takes a period of time to heal, rebuild your infrastructure. So we just have people to ask them to be patient with this, because it doesn't happen overnight. If it did, my name would be Harry Potter, and my pen in my pocket would be a magic wand, and I'd ask for a whole lot more money. Okay, so that's not going to happen. So the SHINE protocol, sleep. 8 to 9 hours is really what it is. And deep sleep, now again, I ask a lot of my women, especially if you're missing progesterone, are you getting restorative sleep? Well, Dr. Spark, I sleep 10 hours, but I feel terrible when I wake up. Is it restorative sleep or not? If it's not, we need to work on that. Okay? The hormones to treat with bioidentical hormones. There's probably 80 hormones in your body. We don't deal with about 12 of them, but there's a lot of hormones in the body, and we check them. Does anybody in this room have a weird thing when you stand up, feel lightheaded, dizzy, or tired? One. And then do you feel like you have to urinate too much? That's usually a concept of that you might have low aldosterone levels, and we would need to address that and help you, and it's simple and inexpensive to do that. Then the hormone replacement therapies. And then infections, candida, would need to be treated, and all other infections that happen. Any of you have cravings of starches or sweets that you can't control? It's almost always 100% of the time candida in your intestinal tract. It's pretty easy to get rid of, and they'll say, Dr. Block, I don't crave anything anymore. I'm great. But you think it's you. I'm bad. I really crave chocolate all the time. It may not be you. It may be candida, which is a fungus which acts like a parasite, and it makes you eat carbs and sweets. But these other infections can be very devastating. Had a lady named Sarah that she had been to 10 gastroenterologists in Dallas. 10. They could not find anything wrong with her, but she was in agony. And they said, maybe the ampular water was off. Anyway, so I said, girl, this is CMV until proven otherwise. So we tested her. She had CMV. So Florence started giving her our, the other IV we don't have anymore because we can't get the ingredients anymore, but we gave her an antiviral IV. And I passed her in the hall one day. She was coming out of the bathroom with her IV pole, and she said, she had a smile on her face. I said, Sarah, you actually can smile. And she said, Dr. Spock, I feel a lot better. But why wouldn't gastroenterologists check for a GI virus? I can't explain that to you. I'm just telling you that that's what we look for, is the things that bother our patients. Nutritional support with vitamins and nutrients. Again, absorption in your gut is truly important. I'm going off on a little bit on my soapbox here for a moment. I do not want you eating wheat. Einkorn wheat in America damages the intestinal tract. Whether you feel it or not, it always damages your intestinal tract. When it damages your intestinal tract, you don't absorb nutrients. When you don't absorb nutrients, one, they don't get into your system, so you can't use them. Number two, they go down the tube, and they rot at body temperature and cause methane gas. So if you want to know where that's coming from, you might want to think about avoiding wheat. And it's not GMO. That's not the problem. It's been hybridized, and it makes beautiful bread, but it does not help our intestinal tract. There's a whole bunch of options you can do out there now if you want to. Whole bunch. Kroger's has some great stuff. Like me, I found out with my gallbladder when it got removed that I don't make bile for my meals anymore. I had some very interesting symptoms with that. So now I take bile tablets with each meal and with my omega-3s, so I can make sure that I absorb all my fat because I don't want that rotting either. So absorption is critical. So we must fix that. If you have candida, it's lining your intestinal tract. We must remove it so that you can get the nutrition going through there, okay? So that's important. And then exercise. And I'm going to tell this crazy case. There's this girl that I have. She's probably 35. And she's an exercise maniac. And I've been seeing her for a while, and she complains all the time. It makes me crazy. And her husband always comes with her. He's very nice. And she's getting better. So when he stepped out of the room, she said, "Joshua, I'm trying to get him to get back with sex again, but he's really not interested." Well, I said, "What did he say?" And he says, "Well, you made me turn it off. You want me to just turn it right back on again?" I said, "Well, maybe you need to do like dating, flirt with him a little bit and start with some stuff and sort of work that way because you're ready now, so let's go." But then she kept driving me nuts about her exercise. She said, "Joshua, yesterday I ran a 10-minute mile. I should be able to run a 6-minute mile." And she was just hollering at me about this. And I'm going, "What is wrong with you? I probably can't run a 10-minute mile. What are you talking about?" But she finally, and this is one thing I beg my patients to do, don't leave information out. She says, "Dr. Spluck, when I was a little girl, I was so hyper that if I would exercise really hard, I'd calm down." I go, "Oh my God, you got catecholamine problems. Why do you never told me this before?" She was hyper from what I told you about a while ago where we measure catecholamines for the adrenaline. That's what her problem was. So we're now treating her for that to calm her down. But she was driving her husband crazy and me crazy both. But she was running a 10-minute mile and telling me that she had problems. I'm going, "You need to calm down." Wait a minute, let me go back to that. It talks about, and the issue is in the hospital, when these have patients in the hospital, and they were, surgery or whatever, I tell them, walk till you're half tired. You got to get back to your room. You got to walk back. So only walk till you're half tired. So I tell people, start off real slow and don't do a whole lot, and very slowly rebuild. Because remember, you're burning energy molecules. Timeline, we start doing the things the first visit. And we're actually doing something else in this time frame right here. Oh, hang on. This time frame here is that the liver processes a lot of problems. In America, we're having a lot of liver problems these days. And we're beginning a liver detox, usually the first visit, in order to go ahead and get your liver ready to process everything we're going to start doing. You ladies have heard about estrogen dominance. It's almost always your liver's not working correctly, and we need to do a liver detox, and we need to give you a product called DIM that helps you process estrogen really quick, really well, and the estrogen levels just drop naturally. I don't have to do anything. Then we begin the hormones and some more nutritional sleep aids the second visit. The third visit, we look at the infections, the nutritional therapy, sleep, and we keep adding, and we keep building. And then we get back to this same page again. And foundation of getting well is sleep is the first part of Shin. And so we do anything we can to help you get sleep. Okay? Now, some of the sleep pills, they're not really good for you long term. So we really try to avoid that. But you ladies, y'all have progesterone that makes you have wonderful sleep most of the time. I wish we guys had something that would make us sleep wonderfully. We don't have that. If we've tried it, it doesn't work. But that is something really good that helps with that. A lot of things will help you start sleeping again. But even thyroid helps you sleep. I had a guy that he went to every sleep clinic in Dallas, every one of them. He tried every sleep medicine in every one of them, and nothing worked. Nothing. An office manager had at the time brought him to me and said, and I was supposed to treat him. I said, well, what am I supposed to do with this guy? Anyway, so I saw him. And I said, well, while I'm talking to you, I only have one thing left to offer you. And I says, but can I just check you out? So he had a thyroid problem, so we started treating him with low-dose thyroid. And I gave him this medicine called Xyrem, which is very hard to get your hands on, but I could get it. And I got it for him. But I warned him, if you have hallucinations on this, you have to take more. That's not a real problem. It means you need more. Well, he's pretty much a redneck, and he came back in about a month later, and he said, I ain't taking that crap. Gave me hallucinations. I told you what to do if that happened. He said, I ain't taking it. You can forget it. I go, well, sir, I have, we've gone through every sleep medication known to man on you. So there's nothing left to offer you. He said, well, doc, since you gave me that thyroid and my wife gave me a little chamomile tea, I'm actually sleeping. Thyroid can help you sleep. So really, make sure the body has all it needs to function correctly. And so there's lots of things that happen at night, too, that are very important. And really try not to eat anything before you go to bed. Is the main thing. You don't want the stomach processing things while you're trying to sleep. And this talks about just basic things. And, sometimes CPAP gets rid of that snoring. Partner, and I've had a lot of people switch bedrooms. But again, we really like to fix all those problems. The issue is if you have to wake up every 2 hours to go pee, you're not going to get good sleep. So that needs to be addressed. I talked about that low aldosterone level. That causes you to have nighttime urination. We treat you for that, and you don't get up anymore. Now, again, if it's a bladder infection, well, that needs to be addressed. But we need to make sure you don't have to get up. And then, we probably shouldn't have lights in there. And there's lots of things. There's a guy named Dave Asbury has Bulletproof Coffee, and he talks about spending 30 minutes with red light, and that will help you really have good sleep. I don't know that all of us would do that, but there are many, many things that help you with sleep. And he talks about a lot of things, and we carry several products here. The 5-hydroxytryptophan down there actually helps you make serotonin also. And so serotonin is responsible for depression issues. And the selective serotonin reuptake inhibitors a lot of times will not work because you don't have any serotonin, but this helps you make serotonin. And so magnesium relaxes all the muscles. All these things are things, melatonin is the natural hormone for nighttime, and serotonin is the natural hormone for the daytime. So they all have these roles. Sleep apnea needs to be treated. And there's coming out with some new things. They even have an implantable device that opens up your larynx, and you have a remote control, and it will open up. I've not had a patient do that yet, but there's some new stuff coming. But they have a lot of stuff. They have things that pull your jaw forward so your tongue doesn't block the back of your throat. I would suggest that you not do dairy because it makes too much mucus, and that can block your airways. So there's a lot to that. Restless leg syndrome, lots of things to be done for that. But remember, I said, you want to make sure you have enough iron, you ladies, because that's really part of this. And then there's several things we can do. But that one can be detected in a sleep lab. You may not even know you have it, but they will tell you you have it, and then we have to address that. Because what's happening is you're moving all night, and you're never reaching stage 4 sleep. And then it talks about different treatments. And I think this slide is out of place, but maybe the ferritin is over here as part of the issue of, for iron is one of the things I said. And those help. Prescription treatments, Ambien, Klonopin, Neurontin, amitriptyline, Seroquel, Sinequan. There's a bunch of things that we can use, and we do use, and we're hoping you don't have to stay on those forever. Okay. So my portion is over, and Miss Amanda is going to come up here and go to the next section.
Thank you. So my name's Amanda. I've seen some of you guys before at other seminars. What I probably haven't talked about at other seminars that we do here is I came here as a chronic fatigue patient. That's how I found this place. I had worked in oncology for 10 years, loved my work, and suddenly hit my trigger point after years of other symptoms that had built up, and I couldn't function anymore. I couldn't work, which, my life revolves around. I'm one of those people. And so everything that we've talked about, everything that we're going to talk about, I've been through here, and I very strongly believe in what we do here. It's what inspired me to come work here once I was better. As you see, I'm a perfectly well-functioning person now, and I was not when I got sick. So this stuff really works. The H in SHINE stands for hormones. Hormone therapy. So The body has the messengers called hormones. The hypothalamus is in charge of this. So the hypothalamus is in the brain, talks to the pituitary. Pituitary sends a message to our endocrine glands to make the hormones. So people with chronic fatigue and fibromyalgia tend to have more widespread hormone problems. And a lot of this, can either be the glands themselves, but can also be that regulation, that hypothalamic dysfunction that occurs that causes these issues. So we're going to talk about a few sets of hormones. We're going to talk about some thyroid, which is a gland in the neck, in charge of metabolism, reproductive hormones. Most of us know what those are: testosterone, estrogen, progesterone, and our adrenals, which are kind of in charge of our stress response. So anybody who's a patient here has probably heard Dr. Spurlock talk about blood work, and essentially how the labs established the values for normal is they pulled the population, assumed most of them are healthy, did some calculations, and anything other than the 2.5% outliers is considered normal. And as Dr. Spurlock likes to point out, that's mathematical. It's not scientific. It's not medical. But we're all different. I wear a size 5.5 shoe. Who here could fit that much less walk in it? Anybody? No. Okay. But it is still normal. It's my normal. And it's normal for some other people out there, not as many. But that's the same idea, is that we all have individually what's needed for us. And besides that, again, as Dr. Spurlock already pointed out, we don't want to run on fumes. We don't want to have just barely enough. We want to have plenty. And so the goal is to reach that optimal function. So the adrenal glands. There's the inner cortex and outer cortex. Epinephrine controls the autonomic nervous system, can increase our heart rate, increase our blood pressure. And then the outer cortex is responsible for the rest of the hormones. So they help you handle stress, regulate the immune response, and maintain blood pressure as well. So mostly we think of cortisol and DHEA. Dr. Spurlock also mentioned aldosterone and pregnenolone. For anybody who comes here has probably heard of that as well. Symptoms of adrenal insufficiency: fatigue, recurrent infections, crashing during stress, low blood sugar, low blood pressure, dizziness on standing. And then we test the adrenals, and again, bottom 2%. And at that point, it's literally life-threatening if you cannot produce these hormones. And they call that Addison's disease, where your hormones are so low, you can't maintain blood sugar, you can't maintain blood pressure, and if you have surgery or severe stress, you may well die. But there's just a small increment. You draw the line here. This is deadly. This is totally normal in traditional medicine, and that doesn't work for a lot of us. So a lot of us will have these symptoms, and we get the test, and they're like, "No, you're normal. You're fine." Well, no, not really. So the way that we address adrenal insufficiency: vitamin C, B5, licorice extract. You guys will see this maybe as glyceric acid in some of your supplements. If you see deglycerizated licorice, it's actually you're missing the thing that you need that helps you prevent cortisol from breaking down. And then these last 4 help you regulate blood sugar when you don't have enough cortisol to help you do it for yourself. So cutting sugar and caffeine, small but frequent meals. If you're going to eat grains, make them whole grains, whole vegetables, fruit in moderation. Fruit's a lot of sugar, and that's a spike, but then it's a crash. And then if you're irritable, eating protein, of course. So obviously we treat these with bioidentical cortisol and DHEA. So bioidentical cortisol will help you with the symptoms of the low blood sugar. It can help with energy. It helps significantly with those aches and pains. And that can be done a couple of ways. We can give you Cortef. You get that at the regular drugstore. Smaller doses. It's not the high-dose steroids that we think of for immunosuppression, where people get the bad symptoms like the moon face and the weight gain. This is taking you from the bottom of normal to those optimal levels. And then, of course, we can give you sustained release hydrocortisone from a compounding pharmacy, which is a bit more convenient because most of my patients forget to take that noon dose of their Cortef. DHEA, we test DHEA sulfate in the blood, and if it's lower than 200 in women or lower than 250 in men, we will recommend taking some DHEA. Should be monitored, even though it's not a prescription. We do like to check those levels, especially women. People absorb these differently, and I will have a small dose go way up here for some patients and a big dose that just hardly touches it. It's very individual. My women, if you're going to take that DHEA and it's too much, you're going to get some acne, you're going to get some chin hairs. It's not doing what you want it to do. It's just too much. And so for those women, because of that same reason, it actually will even help increase testosterone because some of that is converted to testosterone. And then some women will already have elevated adrenal hormones, and we find that this is often with patients who are prone to polycystic ovarian syndrome. So it's not always all low. Sometimes we have, outliers on the other end as well. The thyroid gland, the body's gas pedal. So if we produce too little, our metabolism slows significantly down. People gain weight. There's intolerance to cold. There's a lot of fatigue, achiness, confusion, that brain fog, constipation, depression. The two main thyroid hormones that we think of and that we see tested often are T4, which is like our reserve. It's the inactive hormone, but our body can take that inactive hormone, take off an iodine, and then we have T3, which is that active hormone. So we test for both of those here, and several more in fact. One of the ways that this can be low is Hashimoto's thyroiditis, and that's your immune system attacking. So we can look at antibody levels, and we can even track these and see response to treatment. And another thing, and this is very common in chronic fatigue and fibromyalgia, is hypothalamic dysfunction. So that brain regulation center is just not working properly. And so traditional hypothyroidism, we often see a high TSH. It's the brain signals saying, hey, thyroid, wake up, do your job, make some more hormones. And a lot of our chronic fatigue and fibromyalgia patients, the hormone levels are low, but the TSH is low as well. You're just not sending those signals. Sometimes the body can't convert T4 to T3 properly. That can be a deiodinase deficiency. It can be low selenium, low zinc. And then sometimes you just may need more because your thyroid receptors are resistant and you need more to just kind of bombard them and get them going. And so blood tests may be normal despite needing treatment. And the problem with thyroid testing, especially of our patients with chronic fatigue and fibromyalgia, test normal. The lab established ranges that are supposed to work for us just don't catch those people who are suffering from low thyroid symptoms. TSH is unreliable, as I just talked about. Most doctor's office will use that as their screening method, and only that, no other tests. And they'll say, oh, you're perfect. You're at like 1.0. Well then, but you have no hormones, and a lot of providers and tests won't catch that. If you feel bad and you're in that lower portion of the population, you should be treated. So there's a few different ways to do this. It's very individual, and it kind of depends on what the source of the issue is. So if you don't have any anti-thyroid antibodies, whichever ones they may be, we can use a desiccated glandular preparation. So NP thyroid, Armour thyroid, most people have probably heard of the Armour thyroid. Those come from pork thyroid glands and have a certain ratio of T4 and T3 in them. And it's a nice combination product, and it works for a lot of people. If you do have antibodies to thyroid, obviously we don't want to give you a little bit extra in your system in most cases. So we will give possibly a synthetic combination of T4 and T3, and that may be from a pharmacy. It may be compounded from a compounding pharmacy. There's different options there. If thyroid hormone makes you a little shaky, we might say, okay, maybe we need just to give you a little T4, maybe T3 you're just a bit sensitive to right now. If reverse T3 is high, then okay, reverse T3, it's the opposite of T3, where T3 is kind of your gas pedal. Reverse T3 is like the brakes, okay? It'll work, it'll move into that receptor, and it fits, and it looks a lot alike, but it doesn't do the job, okay? There's no go to it, and then your real T3, the good T3, can't get in that same spot and do its job. So we will give you T3, so then your body says, oh, there's plenty of T3, I won't make any T4, and then there's no T4 to convert down to the reverse T3. So we have a chance to reverse that issue. That explanation makes more sense when I have a diagram, I'm sorry. So moving on, andropause, this is the male menopause, okay? This is when testosterone starts to get low. And I see this more frequently, and I see it younger and younger. So I'm having 30-year-olds coming in, and their testosterone level, if I didn't look at their date of birth, I would assume that they might be 50. It's really surprising how much more common it's becoming. So give it a little tune-up. We test the levels. And this is another one where traditional medicine has established a value of 200. Well, 700, 1,000, people feel pretty good in that level. 200, it's not going to kill you, but you're not going to get off the couch. You don't want to move. You're not motivated, much less do you have the energy. So for younger men, we might give you something to help you produce your own testosterone, and this is good for preserving fertility especially. So something like clomiphene or Clomid, and then HCG injections, will be helpful in that case. And then for men over 50 who aren't really trying to make babies anymore, we might give you straight testosterone, usually in the form of a cream. There are different options, and just the amount that works right for you. So men, again, feel best in that 70th percentile of the normal range. Women have menopausal problems, and so low estrogen and or low progesterone. And this is something that, low progesterone, I see it just about any age, but estrogen and progesterone together, typically with menopause. Worsening of insomnia and fatigue and headache around your period can be a sign. Decreased vaginal lubrication occurs, and that vaginal atrophy that occurs along with that often leads to incontinence. So just the tissues in general are not functioning well. Hot flashes occur, mood swings, I'm sure we all know. And, so the same thing applies to women, essentially. We want to check those levels, give you that little tune-up, get you into those full hormone levels, not the fumes. So treating menopause, again, bioidentical hormones. This can be women who've had a hysterectomy or, had their ovaries removed as well, not just menopause. And for women with chronic fatigue and fibromyalgia, the low hormones can occur, again, as a result of the hypothalamic dysfunction. So not that the ovaries themselves are dysfunctional, but that your brain's just not sending the right signals, or not enough of those signals. And I've already said the treatment's bioidentical hormones, so estrogen and progesterone, various forms again, and your provider will tell you which form is the best suited for you. And then for women, we also consider testosterone, and this is one of my favorite. Okay, we think of young men, 18-year-old men. These are your get up and go guys that really have that motivation and that joy in life. I want that too, So I'm not reaching for the same high levels of testosterone for women as I do for men, but there's that same threshold of how much is enough, how much gives me that feel-good mood, that feel-good energy, and the other health benefits that are coming from it. So again, if you're in that low range, there's a cream. It's a lower dose cream than what I give the men. And this other benefit is that the compounding pharmacy can combine hormones, so the estrogen, progesterone, or testosterone. If that's the same route and the right level, once we establish what levels of each are good for you, they can all be combined for convenience. And so the benefits of treating your hormones, the cardiovascular protection, naturally, decreased pain. Thyroid, as Dr. Spurlock mentioned earlier, is helpful for the pain that comes with chronic fatigue and fibromyalgia. Same thing with the cortisol, very beneficial as far as helping control aches and pains. Increased red blood cells, improved libido, increased bone density. Testosterone converts to estrogen to a certain point in men, and they have the same benefits as women as far as the estrogen giving support for increased bone density. Improves mood, decreases depression, and this is just about all of the hormones. Increases muscle strength, decreases fat levels, decreases hair loss, prevents brain atrophy. So significant benefits from treating the hormones, not just the chronic fatigue and the fibromyalgia, but really overall your functioning and your health. And so in summary, the hormone deficiencies, again, are becoming increasingly popular. I'm seeing it more often. I'm seeing it in younger patients. And that's in both the general patient population, but especially chronic fatigue and fibromyalgia sufferers. Blood testing is not reliable, and not that it's not accurate, but the established ranges are not necessarily what's going to be best for you. And other providers testing those ranges might not interpret those in the same way. They've been taught differently. Optimizing testosterone is beneficial for both women and men. I have to say it's one of my favorites. If I ever fall off that wagon, I start to feel achy and moody and tired, and then I'm like, oh yeah, I forgot to take that, and things just come right back up. And bioidentical estrogen and progesterone in women can be helpful, especially if deficiencies, the symptoms of the deficiencies are worse before your period if you're still cycling. That's a symptom that you may need it despite not being in menopause. And so Roxana's going to come up.
Hi, hello everyone. I'm Roxana Kokos. I'm a nurse practitioner here with Dr. Spurlock 2 years, so I learned a lot from him. So let's talk about infections. Well, Candida, it turns out to be one of the most common infections that we see in patients with chronic fatigue and fibromyalgia. And it's often underdiagnosed and undertreated. We don't have reliable tests for that. We use some blood testing, however, in our patients, but we often base our treatment on your symptoms. So often we see certain rashes, toenail fungus, chronic sinus infections, even leaky gut, that small intestinal fungal overgrowth. It's caused by Candida. What triggers Candida? So again, it's underdiagnosed and undertreated. Overprescribing of those antibiotics. So, you know, you end up having urinary tract symptoms. Well, it could be a vaginal yeast infection, but here you go, you are given an antibiotic. And so you take those antibiotics over and over again without really helping your symptoms. High sugar diet. So you have to be careful with your diet. You have to limit your sugar intake as much as you can. We generally say to get your sugar mostly from fresh fruits and vegetables, but anything that it's processed, like processed sugars, you know, carbonated drinks, things like that, you have to limit that to less than 50 grams per day, which is really not a whole lot. If you look at a can of soda, you have already 44 grams in that, so be careful with that. Candida overgrowth leads to spastic colon, irritable bowel syndrome, which could be manifesting through diarrhea, bloating, a lot of gas, chronic constipation or chronic diarrhea, and also chronic sinus issues. So a lot of times we see patients coming to us, they have those chronic sinus infections, they've been treated with multiple rounds of antibiotics, and yet they're not feeling any better. So oftentimes you end up with a yeast infection in your sinuses, which is really hard to diagnose and more so to treat. And also when you have this leaky gut, you are more prone to increase sensitivities to food, so food allergies and food sensitivities. And those autoimmune conditions, so you start developing those antibodies that kind of attack your whole body over time. So treatments, it's actually pretty easy to do that. Like I said, first you have to put the fire out. So you stop the gas, right? Stop your sugar intake or limit that as much as possible. Sweeteners that we recommend, so stevia or erythritol, it's another one. Definitely cut out sodas. If you drink any of those, they're actually poison to our bodies. And then you have to replenish the good yeast in your diet. There is actually a probiotic that we have and recommend, Saccharomyces boulardii. It's actually the good type of yeast. The name of that product is actually Epicor, the one that we have. Now remedies, so probiotics, and it's a mix of things. It's actually good bacteria along with good yeast. So Lactobacillus bifido and then the Saccharomyces boulardii. So multiple species. I have some rules about those probiotics. They have it to be in a good amount, so at least 10 billions of these colonies forming units. They have to have variety, so 7 to 10 strains. Usually I recommend them with food at dinner time, bedtime, so your body would have time to process those probiotics and help detoxify your body. Lauricidin and monolaurin are actually extracts of coconut oil. And you probably know that coconut oil is very good it's a good antibacterial, antifungal, antimicrobial supplement. Prescriptions, we definitely use diflucan, nystatin, and then along with those two, I actually use those probiotics, and Candicid forte, it's another one that we have here. It's a supplement, which it's a mix of different natural ingredients that kills off this Candida naturally. So we hear about this increase in autoimmunity issues. We see a lot of patients here come in with all kinds of autoimmunity problems. But really, truly, it's triggered by the severe gut infections due to antibiotics, Roundup or glyphosate used on our foods, this excess sugar intake and acid blockers, which already Dr. Spurlock talked about. So what happens with this leaky gut, rather than having those tight junctions, you have this increased permeability, which allows undigested food particles to flow freely. And the same happens for bacteria, viruses, and toxins. So that leads to this overreactive immunity because your body is attacked from all sides, basically. People with chronic fatigue or fibromyalgia, they often think that it's just the infection that is causing them this problem, but this is really just one piece of the puzzle. So like Dr. Sporlock said, we look at everything else because it's not just the infection, that's one piece, but then you have to look at your nutritional deficiencies, your hormones, your diet, your sleep, and everything else. So how do you support your immune system? Well, very easy to do, nutrition. So make sure you eat a good diet. Make sure you get essential vitamins and minerals either from your supplements or from your diet. Cut back on sugar, get good sleep, 8 to 9 hours per night, as much as you can. Digestive enzymes. So for people that have a hard time absorbing, digesting their foods and their supplements, you need to add those digestive enzymes. I would also say for people that have their gallbladder removed, you have a hard time digesting your protein and your fat. So usually I recommend digestive enzymes before meals, and then the ox bile is what we recommend here, and add that after your meals, immediately after your meals with meals that you have a lot of fat and protein. And then optimize your adrenal and thyroid function, which we already talked about that. So the infections that we actually look at, we do a pretty comprehensive panel in terms of infections. So we look at different categories, but Candida or yeast, like I said, we actually measure your antibodies. So your response of your immune system after it's been exposed to this type of fungus, bacteria, parasite, or virus. Parasites are very hard to diagnose. Unfortunately, we don't have very good labs in the United States to identify those parasites routinely, but we actually use Genova, which is a highly specialized lab, and they can actually identify up to 90 parasites. And I've actually seen Candida identify in stool samples as well, so we definitely look at that. Alenia, it's a fairly new drug, but it's very efficient to treat GI issues when it comes to gas, bloating, diarrhea, which is triggered by infections. Could be a parasite, could be fungus, so it's very helpful with that. Bacterial infections, we use certain antibiotics for that. And then viral infections, we have a huge panel of viruses that we look at. And what I've learned really from Dr. Spurlock is that when you see one positive titer, kind of all the other ones gather around. So once you've been exposed to EBV, let's say the Epstein-Barr virus, which is probably the most aggressive one that it's out there, kind of everyone else gathers around. And why? Because it suppresses your immune system, so it makes you more prone to those infections. We definitely use antiviral treatment, so we have options there. We often prescribe oral treatment, but there are certain patients that cannot tolerate oral medicine, so in that case, we recommend antiviral treatment through IVs. This die-off reaction, it's a possibility. Most people do well and don't actually experience this die-off reaction, but it's really truly a way of your body eliminating those toxins that are resulted from this viral medicine killing off the viruses. So it's kind of like a detoxification phase that you go through once you start this antiviral treatment. So if you ever experience that, just reach out to us because we have certain ways to handle that. So we recommend you certain supplements. We kind of guide you through. You just have to push through that phase, kind of get over the hump and allow your body to process the medication. And high doses of vitamin C is also very helpful, and we use that in our IVs. So nutrition, I often tell my patients your food can be either your best medicine or your worst poison. So you choose. Different viewpoints, so definitely eat healthy foods, avoid excess sugar and sweets. Everything that is bagged, canned, or boxed, you really have to read the labels because it's so much misleading and so much misinformation out there. So just don't assume if it's on the shelf and it's on sale, it's actually real food and it's good and healthy to you. So make sure you get educated about your food choices. Choose whole foods over processed junk. If you can read it, don't eat it. If you can pick that up off the ground, it's probably not natural, it's not good for you, so make sure you pay attention to that. And then drink plenty of water. So usually half of your body weight in ounces is what each of us should be drinking almost every day. If you drink coffee, sodas, energy drinks, which we really discourage all of those, you need to compensate for that. So for every cup of coffee, make sure you add a cup of water to compensate that because coffee can actually dehydrate you. The problems with sugar, well, suppresses your immune system. So cancer actually feeds off sugar. Sugar triggers an acidic environment, which cancer cells love. So that's why we have this endemic of cancer in patients that have diabetes, because they're very prone to this. They have a very low immune system. Stimulates yeast overgrowth. We all already know that, right? So Candida likes sugar as well. And amplifies your symptoms of hypoglycemia. So if you have a sugary snack, if you drink a can of Coke or something, it triggers you a spike, so you feel really hyper like for 30 minutes to an hour, and then all of a sudden crush, okay? So be careful with that. Cut soda and sweetened juices. If you really have a sugar craving, go for dry fruits like dates, figs, dry fruits in general. Have a little bit of dark chocolate if you like. Make sure it's fair trade, organic, has high cocoa content. And drink beverages, like I said, sweetened just with stevia and erythritol. So avoid the sugar. I don't know why we need to have so much sugar in these soft drinks. It doesn't make any sense to me, but that's what we have out there. The problems with multivitamins. So unfortunately, we don't get enough of those essential supplements, minerals, vitamins from our diet. And so we need to supplement. I used to think that we don't need a multivitamin until I learned that if you don't eat 3 buckets of fresh fruits and vegetables every day, and if they're not fresh, clean, organic, ripe in season, you're not going to get the dose of what your body actually needs. So for that reason, we recommend a multivitamin to almost everyone. The quality does matter. It's a multi-billion-dollar industry when it comes to these supplements. Everyone's going to try to sell you something, and they all have claims for the best of the best of the best. So you really need to be educated on choosing those supplements. Always read the label, look at the sourcing, read the quantity, the quality, the purity, because that affects your absorption as well. Always read the inactive ingredients or the other ingredients, because that's where they make it or break it. That's where the junk, the bad fillers are thrown in. And definitely avoid buying them at CVS, Walmart, Walgreens, Costco, Amazon, eBay, places like that. Your best source of quality supplements is a physician's office that knows how to pick and choose those supplements. A compounding pharmacy, we have access to the good quality supplements. There's also a website that I recommend for people that want to do their own homework online. It's called consumerlab.com. It's a membership website. You pay like $40 per year. And this is a third-party testing where they pick different supplements, they test them, and you get those reports, those blogs, those letters. So it would help you to kind of pick and choose in terms of supplements as well. Going back to the supplements that we recommend for patients with chronic fatigue and fibromyalgia, so Dr. Spurlock already mentioned those, but B vitamins, those are absolutely essential. Those are the molecules that give you energy. They're good for your brain, for your nervous system. They help your liver detoxify. Some people have that MTHFR mutation where they cannot process those B vitamins properly unless they have them in a methylated form. So to be honest, I recommend methylated B vitamins to everyone, even you do or you don't have that mutation. And if you cannot absorb it, there are injections that we can prescribe to you. And I actually have quite a few patients on injectable B vitamins. Fish oil, another one of those repair molecules, brain food. Every cell in our body is made of fat and water, so we have to have those omega-3 fatty acids. You get them from fish oil supplements, from your diet, eggs, nuts, avocados, good quality fat and omega-3s. There are a lot of studies to show that actually a mix of the supplements, vitamin B and fish oil, actually helped people with symptoms of depression, anxiety, ADHD, ADD. So there's a lot of points showing the benefits of these. Iron. Well, Dr. Spurlock already talked about this, but really low iron can cause you a lot of problems. We test for iron pretty much every single patient that we see as a new patient, and then we kind of keep track of that over time. But everything that it's listed in here, it's due to low iron, so it affects a lot of body parts. Must be taken on an empty stomach or you can lose absorption. It kind of depends on the variety of iron that you use as supplement. We actually have some options now, so some are better absorbed on an empty stomach, some are better absorbed with food. So it kind of depends on your preference and what worked for you in the past. Ferritin, it's actually a protein that is the taxi cab for iron. So we check that level of baseline. If it's really low, we know you're low on iron, so we need to supplement. If it's really high, that could be a problem also, because this is an acute phase reactant marker for inflammation. So that means if it's really, really high, you have active inflammation going on in your body. So an optimal level, it's anywhere between 60 to 150 at most. Mitochondrial dysfunction. So this is a big, big problem, more so in people with chronic fatigue and fibromyalgia. Mitochondria is your power source for every cell in your body. As we age, we lose those type of cells, and so we need to be careful of what kind of supplements we take to replenish this. You lose 20% of your energy when you have this mitochondrial dysfunction. It affects all those listed here, so hypothalamic suppression, which we already talked about. So it suppresses your hypothalamus. You cannot send those messengers, those endocrine messengers to the rest of your body. You do not make those hormones, and then you suffer the consequences of that. Brain fog affects your neurotransmitters. So we talk about here serotonin, dopamine, your thyroid hormones as well. It also, because your body cannot detoxify properly, so the function of mitochondria is to improve your energy, improve your metabolism, and kind of detoxify your body. And so if you are low on this, you are not able to detoxify properly. So you build up those toxins. Could be heavy metals, could be undigested food particles, and so on. And so it triggers sensitivity to the lining of your gut. Post-exertion fatigue. So I sometimes see patients coming to us for the new visit with chronic fatigue and fibromyalgia, and often I hear from them, I try to exercise my way out. It doesn't work that way, unfortunately, because if you're depleted on all these levels, you actually feel worse. You don't have the resources to detoxify properly and get rid of this lactic acid, which builds up after intense exercise. Bad digestion, we already talked about that briefly, but like I said, gut infection, bowel problems, so diarrhea, constipation, bloating, all of that. And then heart dysfunction. This is absolutely essential for your heart. To pump properly, you actually have to have good mitochondrial function. So energy boosters, there are all kinds of supplements that we recommend, but those are kind of like the basics. So CoQ10, unfortunately, as we age, after the age 40, we make less and less of this enzyme. And this kind of regenerates your mitochondria. So it's important to have good amount of this in your supplements, in your diet. We start with 100 milligrams twice a day with food, but I have patients where I recommend twice the amount. So if 100 milligrams twice a day is not good, is not enough for you, double that up, go up on that one. Do not take with cholesterol medicine. Well, we don't actually prescribe cholesterol medicine here. We have certain protocols that we follow, and we actually have good results with that. But if you're on a statin, make sure you take CoQ10, okay? Malic acid, we found this in apples, in pears, fruits, vegetables, and it's actually an energy molecule as well. But we actually recommend this combined with magnesium. So a mix between malic acid and magnesium helps you with pain and stiffness. So we definitely recommend that if you have issues with that. Acetyl-L-carnitine, this is an amino acid. And this actually helps every cell in your body to use fat as energy. And you can start with 500 milligrams twice a day. You can go up to 1,000 milligrams 3 times a day. So very helpful. And then this D-ribose, it's a simple sugar which we get from our diet, but you can also supplement. And it also gives you a boost of energy. It's actually very good for your cardiovascular function. And for exercise, everything that is listed here, it's good advice, but start low, go slow, increase your pace as tolerated, find something that you actually enjoy. If you like to go out and walk in nature, do that. If you like to walk your dog, do that. And just increase intensity as you can, so don't push too hard. If it's something that you haven't done yet, don't start lifting weights when you feel this bad, okay? So give yourself time to get to that level. And then make a schedule, kind of keep up with your routine. Do at least 2-3 times a week and just increase that as you can, okay? Oh, Mark.
Ma'am. All right, your brain's full yet? Just wait, it gets worse. I'm Lark from over at Abrams Royal Pharmacy. I'm going to kind of change it up a little bit. We're going to talk about a couple of things that Dr. Spurlock and I have used, or actually he prescribes it, we make it, as adjunct therapies. So this has been very, very exciting. So the first one is LDN. LDN stands for low-dose naltrexone. So naltrexone is actually, we all know opiates, right? Morphine type things. We know about the whole opiate crisis. What this does, it blocks the action of the opiates at higher doses. When we start using lower doses, it acts a little bit differently, and I'll kind of show you how that works. Right now, I mean, it's available as a 50 milligram tablet. We're going to go like 100th this strength. Before we start getting into that, let's get some definitions out of the way, right? So we've got these things called endorphins. There are happy neurotransmitters. They give us happy feelings. They also work to reduce the perception of pain. They don't necessarily take the pain away. We get so happy that we forget that we've stubbed our big toe. That kind of a thing. We have this natural reward circuit. We get happy when we eat. We get happy when we drink. I sure hope we have happy sex. And that runner's high. Now I will tell you, if you ever see me running, something's chasing me. That's not my favorite exercise. We're going to reduce stress, improve mood, decrease that depression and anxiety. Going to help that sleep and increase positive outlook on life. So these endorphins are they're happy neurotransmitters. The kicker is that opiates look like endorphins to the brain. So these endorphins are actually produced over in like the hypothalamus area, that center part of your brain. We're going to get pain relief. Again, we're going to get that sense of well-being. Endorphins actually mean endogenous morphine. And morphine was one of the first opiates. So when we increase our endorphins, we're increasing our euphoria. Now, naltrexone in 1984 is licensed as treatment for opiate addiction. Kind of a cool thing, because naltrexone will block those opiate receptors. And it prevents the euphoria. So when we're on this, when we have people that are using naltrexone to help get off of the opiate medications, so you're reducing the opiates and you're increasing the naltrexone. If you have opiates on board, you're not going to get that happy feeling from them. So this is how it's helping that addictive type brain. Then in the 1980s and 1990s, we got naltrexone using widely accepted for abstinence for opiates. So we've got this relationship again with the opiate and your opiate blockers. Patients are gradually titrated down from the opiates before beginning the naltrexone, and we're looking at anywhere from 50 to 300 milligrams. So again, we're looking at some really high doses with this. Now we've been talking about how things work. Okay, when we're looking at, I've lost my words. I have not had dinner yet. So we're looking at receptors and neurotransmitters. Everything works like a lock and key, all right? So you can have a key to a lock, and you can put it into the lock, and you can turn it, and it'll open a door, all right? That's your agonist. Then we have the opposite of that. You can put your key into the lock, and you can't turn it. It's not going to do anything. It's not going to open the door. It's just not locking. But what it is doing, it's blocking anything else from happening. Then you get something in the middle. So you get your key, it can go into the lock, you can turn it and you can open that door a little bit. You can peek through, but you can't completely open up that door. And this is the beauty of where the low-dose naltrexone is going to work. So at our high-dose naltrexone, what this does, it is going to sit on that receptor all day long. It's not going to budge. With low-dose naltrexone, it's only going to sit on that receptor for about 4 to 6 hours. So we've got on and off, on and off. Now we have these endorphin receptors on our immune cells, and since they're on our immune cells, this should be a pretty critical thing that we've got to look at. So back in 1985 again, we found a paper publishing about endorphins that concluded endorphins can be considered immunomodulators and maybe become a tool in the field of immunotherapy. Pretty cool stuff. So now we know that LDN binds to our opiate and the endorphin receptors for a short period of time, and what this does, it tricks the body in creating more endorphins. More endorphins, reduce pain, we're happy. So on one side of the naltrexone hand, we've got the partial blockage of these opiate receptors. It's going to increase the endorphins, we're going to help regulate the immune system, and we get reduced cell proliferation. You can read into that as you will. Now, it also does another thing on these different types of receptors called toll-like receptors, and it will completely block these toll-like receptors. So we're going to get reduction in inflammation, immune modulation, and we're going to downregulate cancer genes. So back in 1985, all the cool stuff obviously happened in 1985, including me graduating from high school. So these toll-like receptors were actually first discovered. The research is still continuing. This is only 35 years old. Wow, I just aged myself. Present on all those immune cells, essential part of the immune system. And these toll-like receptors can produce something called NF-kappa B. That's what this funny little doolally is right here, NF-kappa B. NF-kappa B signals the immune system to cause inflammation. Now, some inflammation is good. Okay, if you break your arm, you want inflammation because that's going to help immobilize the arm. We don't want that on a chronic type situation. LDN will block that toll-like receptor, so it's blocking inflammation. Another cool trick. For example, there is one toll-like receptor called TLR4. It causes inflammation that results in symptoms of neuropathic pain. LDN blocks that, so it's going to block that neuropathic pain. In autoimmune diseases, now what we have here is that the immune system starts ramping up and acting crazy and starts attacking our cells. There again, we're blocking this. This is going to work on those toll-like receptors, so we're going to block that action that the immune system has on there. So we're getting our body to produce. We don't want the body to produce inflammation against itself. So we block those receptors, we're going to get that inflammation decreased down. So here's a bunch of conditions where LDN may help. MS, Hashimoto's, Crohn's disease, rheumatoid arthritis, wound healing, chronic fatigue, and fibromyalgia. I cannot tell you, okay, Dr. Spurlock gets to see patients, what, every 3 months, every 6 months, every year? I get to see you guys every month. And every month when I get people coming in going, oh my gosh, I'm so excited, I'm picking up my LDN because it makes me feel so much better. All my symptoms are coming down. I'm like, ooh, can my heart be any warmer? That is just absolutely perfect. Complex regional pain syndrome, RSD, Lyme's disease, nasty bug, nasty disease, and a whole lot more. Like I said, the research is still coming out on this, and then we get cool doctors like Dr. Spurlock who's like, I wonder if it would work for another issue. And then we'll get to find out. So there's several dosage forms we can do with this. The most common is going to be a capsule. It cannot be a slow release capsule because if we make it a slow release capsule, it's going to sit on those receptors for a longer time, and we don't want that. We want it on and off about every 4 to 6 hours. You can only use certain fillers. There's one called Avicel, which is microcrystalline cellulose, and so you'll see that listed on some of your supplement bottles. Lactose, or the D is dextrose. Now this starts becoming problematic when we have people allergic to corn and milk, so we don't want to exacerbate that, so then we'll hop back over here to the Avicel. We can do oral liquids or sublingual drops, and I will tell you, because I'm the king's taster in the lab, it's bitter. It's not in my top 5 things I will never put in my mouth again, but it's probably in my top 10. And it does have a short shelf life. because when this hits water, it's good for about 14, 15 days. And so as much as we would love to see you come in every 14 to 15 days, that's going to put a damper on your life. Now, we have found when we put this into a cream that we're helping with neuropathic and shingles pain. So we've had several shingles patients with that postherpetic neuralgia. We're getting this LDN on board, and it's squelching that pain. Psoriasis, it's been pretty cool for that. And vulvodynia, which is like a pain and a throbbing that some women get with the vaginal area. So the big thing that people ask me is like, when am I going to start feeling better? I'm like, I would love to say you're going to start feeling better tomorrow morning, but this one's going to take some time. So we say let's give it at least 3 to 4 months before we completely throw it in the trash. If we've got a longer situation going on, chronic fatigue fibromyalgia did not happen overnight, so it's going to take some time to get this through. It can take up to 18 months. Let's just keep working on it. If we've got chronic inflammation, again, it's going to take time. Dosing is very individualized, but for the most part, we start with about a 0.5 milligram, and you start working your way up. Every few weeks, you start increasing it by another 0.5. Somewhere along there, you're going to feel amazing. And then, let's say the next week, you increase it to, let's say, 3.5. And you're like, oh, you know what? That aching's coming back. I'm just not feeling myself again. My energy's dropping. Okay, back it up. Go back to the 3 milligram. That's where your happy dose is going to be. So start low, go slow, and we'll just find out where your happy place is. So another thing that we have used quite a bit, a little over a year ago, actually it was about 2 years ago, when all the hemp and the CBD starts, hitting, and I'm thinking, oh wow, what are we going to do? So I start doing all the research, finding the good companies, and there's a whole lot of trash companies out there too. But y'all know this guy, right? I love it when he admits, I might have made a mistake. So he says, we have been terribly and systematically misled for nearly 70 years in the US, and I apologize for my own role in that. I apologize because I didn't look hard enough until now. I didn't look far enough. I didn't review papers from smaller labs in other countries doing some remarkable research, and I was too dismissive of the loud chorus of legitimate patients whose symptoms were improved on cannabis. Now, cannabis. We're talking hemp, we're talking marijuana. Both, actually. Because the cannabis plant is like saying apples. Okay, well, you got your Granny Smith, you got your Red Delicious. They're 2 different apples, they have 2 different properties, and they're going to taste different. They're going to do things different in your baking. So hemp is going to grow like bamboo. It's tall and skinny. Marijuana is going to be short and fat. It's more of a bush. But realize, when you start doing your own research, when you start reading about this, depending on who is writing the article, a lot of these words are going to start getting mixed up. But know that if you're hearing cannabis and cannabidiol, if you're doing cannabis and marijuana, they're going to be more talking about the medical aspect of it, more talking about like your medical marijuana types. If we're talking about hemp, usually we use that in terms of medicine, we're using that in terms of supplements. It's a little bit different. Now, Dr. Sanjay Gupta has done a wonderful documentary series called Weed, appropriately named. And the first one was about 45 minutes long. You can find it on YouTube. And he does this. It got pretty confusing because hemp, marijuana, cannabis, it all just kind of glommed together. In the next documentaries, he starts delineating out what he's really talking about. But cannabis, as a general plant species, has over 80 cannabinoids. We're thinking now probably closer to 100 plus. The 2 big ones that we know of are going to be CBD and THC. Now, THC, the stuff that's going to make us stoned, we don't want that. CBD won't do it. You could smoke a field of this and not get stoned. In fact, Charlotte's Web, when they were developing their hemp strain, they had it nicknamed the hippie's disappointment. because you could smoke it and you wouldn't get stoned. But they increase the CBD concentration, they decrease the THC, and so now it's got a different chemical profile, and we're using it for different things. So in the grocery stores, we've had this stuff for ages. We've had hemp seed oil, we've had hemp hearts and hemp seeds. Great food. Lots of B vitamins, lots of fiber. We love this stuff. And I did not know this, but hemp in its raw form is the second highest amount of protein of any food. Soy's the highest. But what's wrong with soy? Heavily modified, GMO, heavily pesticided, and for a lot of people it's going to give them thyroid problems. So we want to stay away from that, right? And the hemp protein more closely resembles our protein, so it's easier to digest. So yes, put this on your salads, okay? Put the oil in your smoothies, have some fun with it. Now hemp extract as medicine, okay, this is all coming from the seeds. The hemp extract is going to come from everything else. So we're looking at the leaves, the flowers, and the stalk of the hemp plants. That's where the majority of the CBD is. No CBD in this, no THC in this at all. Hemp can contain upwards of 15% CBD. It's a pretty big dose. It can contain no more than 0.3%. Now this is where I've had a lot of fun when I listen to commercials. What's the difference between 0.03%, 0.3%, and 3%? It's just a decimal, right? Okay. The real number is 0.3%. But know what you're buying because there's a whole bunch of junk out there. We got these CBD shops popping up all over the place. I mean, they're just coming up like little weeds all over the place. So in the 1980s, there again, the 80s were rocking in more ways than one. We found these receptors in the brain. And this all happened during the war on drugs. So they're trying to figure out, why does marijuana make people act the way it does? Well, then they found out that we have these receptors in our brain. And they're like, okay, why do we have these receptors if our body doesn't make THC? What's going on here? So then hop up about 5-10 years, we found out that there's something called the endocannabinoid system. And it's all over the body. And it's going to regulate things like cognition, memory, mood. It's huge in fertility and pregnancy, and it even has a beautiful thing in nursing. The mother emits an endocannabinoid that tells the baby, nurse here. Pretty cool. Appetite, pain sensation, that runner's high again. There again, if I'm running, I'm being chased by a bear. Locomotion, movement, motivation, positive or negative. So you can be a Scooby-Doo or you can be a couch potato. And that immune system. So we don't make THC or CBD on our own, right? But we do make these other things that we've kind of nicknamed bliss hormones. One of them is called anandamide, and there's the big long word for it. We're not going to pronounce that one tonight. Otherwise known as AEA. The name is actually based in Sanskrit. Joy, delight, and bliss. Kind of nice. There's another one called 2AG, another big word that we're not going to pronounce tonight, associated with pain relief, suppression of vomiting, stimulation of appetite, and the inhibition of tumor growth. So we found two different receptors. There's a CB1 and a CB2. The 2AG is more going to hit on that CB1. That's also where THC hits. And the anandamide is going to hit more on the the CB2. That's more where CBD is going to hit. So anandamide has got some pretty cool functions. Decreases pain. It's going to help modulate that appetite. So it's not going to give you the munchies, and it's not going to make you starve yourself to death. It's going to modulate it. It's going to increase and decrease it as we need it. We're going to enhance motivation, the pleasure response to food, sex, exercise, music, arts, and all that good stuff. For women, again, it increases during ovulation. So if we're happy and we're ovulating, we can make babies. Helps put the brakes on cancer cell proliferation, and there's quite a bit of studies on that. It's been pretty interesting. Increases neurogenesis, which is formation of nerve cells in the adult brain. There's also some really cool information about how marijuana affects the adolescent brain versus the adult brain. Adolescent brain, okay, I'm sorry, boys, and I've got two of them, they're 20 and 21, they're not going to have brains until they're about 25, 26. promise. But we're finding that with, say, like Alzheimer's and dementia patients, a little bit of THC can actually help with that. Pretty cool. Anti-anxiety, antidepressant properties can actually help protect from stroke, chronic pain, and neuroinflammation. So here are these two different receptors. So we're going to, just to make it easy, CB1, we're going to kind of think of that as the marijuana receptor. It's kind of down the middle. So we're looking at the brain, CNS, and the spinal cord, the hypothalamus and the pituitary, and then your major organs and our major reproductive organs as well. The CB2 receptors, think of those as your hemp receptors, eyes and heart, just like they were back here. But we're also going to catch the stomach, the pancreas, the GI tract, bone, blood, peripheral nervous system, so that's everything out here, immune system, and the CB2 receptors appear to be responsible for the anti-inflammatory effects. How's that for a cool trick? But there's a synergy. Just like if you're talking with any kind of a plant, there's always a synergy, all right? So marijuana's not bad, hemp's not bad, but you put them together and two things that we get some cool balances going on. So we're thinking of CBD is the good guy and THC is the bad guy. Everyone's got their benefits. When you combine them, what we're finding is that the CBD will kind of squelch the stony effect, that buzzy effect from the THC. So in states that are not Texas, like Colorado, you can get like a 1-to-1 mix. Again, we're using plants and we're using their constituents for a particular purpose. So we're going to get all that great balance going on. Now, the U.S. has not really studied cannabis in any form because it's been illegal since about 1937. So all the research has been happening over in Israel. U.S. has been funding some of it, I found out. I thought that was kind of interesting. All of this, there is scientific data behind every bit of this. Very, very interesting. Big ones we want to concentrate on: neuropathic pain, inflammation, autoimmune disorders. But I double dog dare you to look at this list and tell me that you don't have at least one of them. Now, with anything that we're going to use as a medicine, sometimes we found out, oops, there's some side effects. Sometimes when you mix herbs with medications, we get some unwanted side effects. We're kind of learning about this. Cannabis, marijuana, hemp, THC, or CBD can actually deactivate certain liver enzymes that help pull other medications out of your body. So the quick down and dirty way to figure this out, if you're on any medications that have this problem, if you've got a little sticker on there that says don't drink grapefruit juice or eat grapefruit when you're on this medication, okay, same thing with this. This is your grapefruit. It can thin the blood a little bit, so be careful if we're on blood thinners. And then there's a variation in a gene called AKT1, which is linked to people being more susceptible to the mind-altering effects of cannabis. So there are people out there that they smoke marijuana and they don't like the effects. There's why. So know what you're buying, okay? And like I said, I mean, how many CBD shops did y'all pass on the way up here? Okay, quite a few. They're just popping up everywhere. So in 2016, just 3 years ago, the FDA purchased and tested 24 products labeled as hemp or CBD, and the majority of those products were found to be mislabeled. Oops. Only 2 of the products tested met their label claim. A year later, a study published in JAMA tested 84 hemp products and found that only 26 were accurately labeled. And then both studies, they found there was some extra THC in there that really should not have been in there. And there have been some hemp products that have been recalled for high levels of pesticides. Okay, if you know anything, and I don't know anything about growing anything, if you give me a green plant, I promise I'll kill it. My kids are great with plants, I'm great with kids, so we make it work. The cannabis family is known as a phytoremediator, meaning it sucks junk up out of the soil. So hemp does not need, and marijuana either, does not need pesticides. They don't need ladybugs to take care of, they're not affected. So anything that is coming up with pesticide residue is coming up from the soil. they've actually used hemp around Chernobyl to help get some of the junk out of the soil. Pretty neat stuff. Oh, look at that. I didn't know that was going to move. Hello. So again, when are we going to start feeling the benefits on this? And it depends on what we're using it for. Anxiety and obsessive compulsive disorders, we're going to start getting better about 2 to 4 weeks. We're going to start noticing that did I turn the light off? Did I turn the light off? Did I turn the light off? Okay, in a couple of weeks, we're going to start saying, oh yeah, I turned the light off. It's all good. Inflammation, pretty quick. 1 to 2 weeks, we start seeing results with that. And again, autoimmune, because it took a long time to get there. It's going to take a little bit of time to get that down. There's a bunch of different dosing options. In fact, I was looking at, I want to go back to this guy. This little guy that moved, this U.S. Hemp Authority. This is basically the hemp family of growers. They're starting to regulate themselves because they realize there's a bunch of junk out there. So look for that seal. Okay? Now, I was looking through the Hemp Authority. They've added some extra people on there, and I'm like, great, we got more people doing quality supplements, and this is exactly what we want to do. Raise the bar so everyone can get there. There's a bunch of different doses out there, and this is where the math starts to look like an SAT word question, right? 15,000, 500, and you're thinking, oh my God, if I do something that's 15,000, it's got to be so much stronger. Yeah, but the bottle is 200 mLs. That big number, 15,000, is per the total bottle. So you've got to turn the bottle around, or find out how much, look at the bottom, find out how big the bottle is, turn it around, find out what your dosing is. A little bit of math. If y'all ever get stuck with that, just give me a call. I like doing stuff like that. But in general, we're looking at starting with a dropper full 1 to 2 times a day. Once we start going much past 2 droppers a day, there again, come in and let's get you something stronger, because this is not cheap, but it's not horribly expensive either. But if you're doing 4 droppers a day of the low dose, let's get you the higher dose so you don't have to take as much and you'll save money in the long run. If the dose gets too high, you might feel a little, not woozy, it's like you're too calm. And I was like, really, can we put that in the Dallas water supply, please? But I've been there. I've got obsessive compulsive disorder a little bit. I've got anxiety a lot. I can panic attack with the best of them. My dose, 60 milligrams twice a day. And I don't freak out about stuff, except when QuickBooks crashed on us Tuesday. That was a little bit of an issue. And now Will's going to tell us the rest of his story.
Thank you, Lark. So appreciate all the things that Lark presented just now, and should know that Abrams Royal Pharmacy makes the compounded medications that make what we do at Renewed Vitality possible. So we have a great relationship with Abrams Royal Pharmacy, and we really appreciate working with them. So this is what I went through just a little while ago, as far as how did I get so old and so tired. And so like I said, I wanted to do something about it, and so I started going to doctors, and I went to a primary care doctor, and then I went to an endocrinologist, and then I went to an internal medicine doctor, and neurologist, and finally, after going around with a lot of doctors, they all said, well, it must be in your head, so you go to a psychiatrist. And they all told me the same thing too, and that is they do some lab work, and they say your lab work is fine. So you're within the normal range. So, but in spite of all that, I felt awful. And so, you know, the other doctors were telling me I was fine, but they weren't paying attention to how I was feeling. And so with the help of Dr. Spurlock, who did some testing and listened to how I felt, not just what the lab said, and also didn't just look at what the normal range was in lab work, but was focused on what the optimal range was and how I was feeling in each different of those lab categories. And treated me. Yes, I had something going on with my thyroid, and so that had to be treated. And yes, I had something going on with my male hormones, my testosterone, so that needed to be treated. Remember what they said about viral infections. I had Epstein-Barr, which is mononucleosis, and I had a number of other viruses, so that had to be treated. But when each of these things were treated, it didn't happen overnight, but over time, I started to feel better, to the point where my wife and I went on a cruise together, and I had more energy, more alert. I was 35 pounds overweight, and over time, about a year and a half, the weight just slipped off. So, and better memory, increased sex drive, better sleep, and generally a much happier life. So I was able to get my life back. Now, what makes Renewed Vitality special and different from all those other doctors that I went to? First of all, we take the time to listen. And all the appointments are about an hour long. And for the complicated patients that we see, that's about how much time it takes to go through things and get a diagnosis and treatment plan. Secondly, we do very comprehensive lab testing, far more than the average physician will do. And it's to help us to get to the root cause. And then we provide an individualized treatment plans, and from that, people do get better. So with that, I know we've been here a while, but if you have questions, if you'd like to please, now's the time to ask any questions that you have. If you would like to make an appointment or get more information, please see me at the desk out here, and I can take care of that for you. Thank you for coming.